10 best ways to get rid of mucus buildup in the lungs. Did you know that over 14 million Americans have chronic obstructive pulmonary disease, often caused by lung mucus buildup? It might sound surprising, but that sticky, slimy substance we often think of as just a minor annoyance plays a much bigger role in our health. Mucus is designed to protect your lungs from harmful particles, but when there's too much of it, it can cause serious trouble. In this video, I'll tell you about the 10 best ways to get rid of mucus buildup in your lungs and keep your breathing clear and easy. Whether it's using natural remedies, making simple lifestyle changes, or trying specific techniques, you'll learn proven methods that really work. Remember though, everyone's health is different. Always consult with a healthcare provider before trying any new treatments. Also, stay tuned to the end to learn about the hidden health risks related to excess mucus. Now, let's get started. 1. Steam inhalation. Steam inhalation is a powerful and natural way to relieve mucus buildup in the lungs, working quickly to provide relief. The warmth of the steam plays a crucial role in this process. As the moist heat reaches the airways, it softens the mucus stuck to the walls of your respiratory tract, which includes your nasal passages, throat, and lungs. The temperature of the steam relaxes the smooth muscles around the bronchial tubes, which are responsible for carrying air into the lungs, helping them expand and contract with less resistance. This combination of loosening the mucus and relaxing the bronchial tubes allows you to cough up or clear out the mucus much more effectively, which can provide quick relief from congestion. Steam also stimulates blood flow to the respiratory system. As your airways warm up, blood vessels expand, improving circulation to the mucous membranes in the lungs and throat. This increased blood flow brings in more oxygen and nutrients, supporting the cells that are actively working to clear out pathogens and irritants trapped in the mucus. More importantly, it encourages a natural drainage process in your sinuses and lungs. By promoting circulation and hydration in the respiratory tract, steam inhalation not only helps clear mucus but also soothes irritated airways, which can reduce further mucus production. Based on the findings of a study published in PubMed, steam inhalation was found to be effective in alleviating headaches in patients, but it did not significantly improve nasal irrigation in terms of reducing congestion. 2. Controlled coughing. Unlike a regular, spontaneous cough, controlled coughing is intentional and structured, designed to loosen and move mucus from deeper areas of the lungs to the upper airways, where it can be expelled more easily. This method is all about using targeted breath control and muscle engagement to get the job done efficiently without causing unnecessary strain on the lungs or throat. The process begins with taking a deep, slow breath through the nose, filling the lungs completely. This deep inhalation helps expand the airways and create space for mucus to move. Once the lungs are full, the next step is to hold the breath for just a couple of seconds. This slight pause gives the air pressure inside the lungs a chance to distribute evenly, reaching all areas, including those where mucus may be lodged. The controlled cough itself is not forceful. Instead, it's a sharp, deliberate cough that engages the diaphragm and abdominal muscles rather than just the throat. This approach generates a steady wave of air pressure that can effectively push mucus upward without causing irritation or strain. After each controlled cough, it's common to feel the mucus rising, sometimes even reaching the back of the throat, where it can be spit out. 3. Chest percussion. Chest percussion, often called chest clapping, is a technique that can help loosen and move mucus out of the lungs, making it easier to breathe and clear congestion. This technique involves rhythmically tapping or clapping on the chest and back over the areas of the lungs where mucus has built up. By applying a gentle but firm motion to these areas, chest percussion creates small vibrations that travel through the chest wall, reaching into the lung tissue. These vibrations work to shake up and loosen mucus that may be clinging to the walls of the airways, especially in the deeper sections of the lungs where mucus can settle. The mechanism behind chest percussion lies in its ability to mobilize mucus by physically disturbing it. When the chest is tapped, it creates a series of soft shock waves that pass through the lungs, breaking up mucus and releasing it from the airways. The lungs are layered with tiny hair-like structures called cilia, which are responsible for moving mucus up and out of the respiratory system. Chest percussion stimulates these cilia, helping them push the loosened mucus toward the upper respiratory tract, where it can be coughed up or swallowed and expelled naturally by the body. By aiding the cilia, chest percussion supports the body's natural clearance processes and helps move mucus along more efficiently. 4. Herbal teas with anti-mucolytic properties. The warmth of the tea alone can help to relax the airways, which is the first step in allowing mucus to start moving. Warm fluids thin out the mucus by hydrating it, making it less sticky and dense. This action gives your cilia, the tiny, hair-like structures that line your airways and help move mucus, a better chance to do their job effectively. Warmth and hydration help these cilia move mucus up and out of the lungs more efficiently. But beyond the warmth, the active compounds in these herbs bring additional, targeted effects. Take ginger, for example. Ginger contains bioactive compounds like gingerol, which has both anti-inflammatory and anti-mucolytic effects. These compounds work on the mucus itself, breaking it down at a molecular level and reducing its thickness. This loosening effect allows mucus to travel more smoothly up the respiratory tract, where it can be expelled. Peppermint tea also works wonders for mucus buildup, thanks to menthol, its main active ingredient. Menthol has a cooling effect, which soothes the respiratory tract, but it also works as a natural decongestant. Menthol helps to open up the airways, allowing for better airflow and, therefore, making it easier for mucus to flow out. According to nutrients, black tea phenolics support gut health by positively influencing the intestinal microbiota, which can strengthen the mucus layer in the gut and reduce inflammation. This improved gut health and reduced inflammation may indirectly help lower overall mucus production in the body. 5. Use a humidifier. When you breathe in the moist air from a humidifier, it enters your respiratory system, hydrating the mucus lining that coats your airways. This added moisture works on a molecular level, loosening up the bonds in thickened mucus. Imagine the mucus shifting from a dense, sticky consistency to something more fluid and easy to move. With thinner mucus, your body's natural mucus clearing system, known as the mucociliary escalator, can work more effectively. This system relies on tiny hair-like structures called cilia to push mucus up and out of the lungs. Cilia function best in a hydrated environment, and the moist air from a humidifier provides the ideal conditions for them to move efficiently. The cilia are able to wave in coordinated motions, transporting the mucus to the throat, where it can either be swallowed or coughed out. A humidifier also helps soothe the airways, which is especially beneficial if there's inflammation present due to irritants or allergens. When the airways are irritated or inflamed, they can produce even more mucus as a defense mechanism, trying to trap and remove harmful particles. The moist air helps to calm this response, reducing the urge to produce excessive mucus in the first place. According to the Cochrane Library, mucociliary clearance, the body's natural process for clearing mucus, is more effective when humidity levels are at least 30%, with 45% humidity providing optimal support for airway self-cleaning. Humidifiers that produce water mist can help reduce mucus thickness, making it easier to clear from the respiratory tract. 6. Deep breathing exercises. Deep breathing exercises are a powerful way to help clear mucus from the lungs by engaging the respiratory system more fully and encouraging airflow to reach areas that may otherwise remain congested. When we breathe normally, especially if we're inactive or dealing with congestion, our breaths tend to be shallow, primarily filling the upper parts of the lungs. However, deep breathing allows air to penetrate deeper into the lungs, expanding areas that may have become restricted and helping to mobilize mucus that has settled in those lower lung regions. The process starts by inhaling deeply through the nose, filling the lungs from the bottom to the top, and allowing your chest and abdomen to expand. This slow, deep breath increases air pressure in the lungs, helping to push against any mucus that may be blocking smaller airways. By filling the lungs completely, deep breathing effectively loosens up mucus, making it less likely to cling to the walls of the airways. This fuller expansion of the lungs is essential for moving and dislodging mucus that has become stuck, especially in areas that may not receive much airflow during regular, shallow breathing. According to the National Library of Medicine, slow and deep breathing techniques help initially loosen mucus from airway walls. Once loosened, slightly faster breathing can then help move the mucus from smaller airways to larger ones, making it easier to clear from the lungs. 7. Consume foods rich in vitamin C. Vitamin C is known for its antioxidant properties, which protect cells from damage caused by free radicals. In the lungs, these free radicals can contribute to inflammation, triggering mucus production as the body's defense response. By neutralizing these free radicals, vitamin C helps reduce inflammation in the respiratory tract, which, in turn, can reduce the body's tendency to produce excess mucus. A PubMed study of 18,737 Italian children found that eating citrus and kiwi fruit regularly reduced the risk of respiratory symptoms like wheezing, shortness of breath, and chronic cough. Children who ate fruit 5 to 7 times weekly had even lower odds of symptoms. For kids with asthma, weekly fruit intake was linked to a nearly 50% lower rate of wheezing over the following year. This suggests citrus and kiwi fruits may help protect against respiratory issues in children. Vitamin C also plays a direct role in immune cell function. White blood cells, particularly phagocytes and lymphocytes, are essential in fighting off infections that can lead to excess mucus. Vitamin C helps these immune cells work at their peak by boosting their production, movement, and efficiency. With a strong immune response, the body is better equipped to handle infections that often result in congestion and mucus buildup. When bacteria or viruses are quickly neutralized by a healthy immune system, there's less risk of prolonged respiratory inflammation and mucus production. 8. Avoid mucus-producing foods. Avoiding mucus-producing foods is a practical approach to help reduce mucus buildup in the lungs, as certain foods are known to stimulate the body's natural production of mucus, particularly in the respiratory and digestive systems. Dairy products are among the most common culprits for increasing mucus production. Foods like milk, cheese, and yogurt contain casein, a protein that can trigger mucus buildup in some people. When you avoid or reduce dairy intake, you minimize this thickening effect, giving your body a better chance to maintain thin, manageable mucus that can move through the respiratory system more easily. Furthermore, when we consume high-sugar foods, such as candy, soda, or sweetened snacks, it can lead to increased mucus production as the body reacts to the sudden sugar spike. Refined sugars cause an inflammatory response in the body, and inflammation in the respiratory tract often leads to excess mucus as the body's way of trapping and removing irritants. Fried and fatty foods can also contribute to mucus buildup, mainly because they slow down the digestive process. This slowdown can lead to a buildup of heat and internal moisture, which the body may respond to by producing more mucus to help with elimination. Apart from that, red meat and other heavily processed meats, like bacon or sausage, contain high levels of saturated fats and preservatives, both of which can lead to mucus production. By replacing these mucus-triggering foods, you reduce the chance of inflammation, giving the lungs and airways a break from constant mucus production. The American Thoracic Society study found that a diet high in meats, sodium, and refined carbs was linked to a 43% higher risk of developing cough with phlegm. 9. Stay hydrated. Staying hydrated is one of the simplest yet most effective ways to help your body clear out mucus buildup from the lungs. When you're well hydrated, the water you drink helps thin out the mucus, making it less sticky and easier to move through the airways. Think of it this way: mucus has a job to do. It's there to trap and eliminate particles like dust, bacteria, and allergens, but when it gets too thick or sticky, it can't flow as it should. This is where hydration steps in. The process begins at a cellular level. Cells in the respiratory system produce mucus as a protective layer, but without enough moisture, this mucus becomes too thick, clumping together and getting stuck. Drinking enough water helps to keep the mucus at an ideal consistency, similar to a slightly watery gel, which flows more freely. This thin consistency makes it easier for the tiny hair-like structures, called cilia in your respiratory tract, to push the mucus up and out of your lungs. These cilia are constantly moving in a wave-like pattern, but they work best when mucus isn't too thick or dehydrated. 10. Regular physical activity. Regular physical activity is a powerful tool for helping the body naturally clear mucus from the lungs, and it works through several interlinked processes that support respiratory health. When we exercise, our breathing rate increases, causing us to take in deeper, fuller breaths. These deeper breaths allow air to reach the lower regions of the lungs, areas that might not be fully utilized during typical, shallow breathing. This increased airflow helps loosen mucus that may have settled in the lower lung lobes, making it easier to mobilize and move toward the upper airways, where it can be expelled. Physical activity also engages and strengthens the respiratory muscles, particularly the diaphragm and intercostal muscles, which are the muscles located between the ribs. These muscles play a critical role in helping us breathe deeply and efficiently. As they become stronger through regular exercise, they allow for a fuller expansion and contraction of the lungs, which encourages the body to push out trapped mucus. Strong respiratory muscles are especially beneficial for maintaining long-term lung health, as they make it easier to naturally clear mucus without relying on constant coughing or other external techniques. According to the European Respiratory Society, treadmill exercise significantly enhances whole lung mucus clearance compared to resting breathing. Physical activity, like treadmill exercise, increases airflow and stimulates deeper, more forceful breaths, which help mobilize and expel mucus more effectively from the lungs. Now, let's discuss 5 diseases linked to mucus buildup in the lungs. Mucus buildup in the lungs is more than just an annoyance. It can contribute to the development or worsening of certain diseases. When mucus accumulates and isn't cleared, it can lead to serious respiratory conditions that impact overall health and quality of life. I have mentioned 5 diseases closely associated with excess mucus in the lungs for you to be aware. 1. Pneumonia. Mucus provides a perfect environment for bacteria and viruses to thrive, increasing the risk of pneumonia. When mucus traps pathogens in the lungs, it can lead to an infection that inflames the air sacs, causing difficulty breathing, chest pain, and high fever. 2. Chronic bronchitis. Excess mucus is a hallmark of chronic bronchitis, a long-term inflammation of the bronchial tubes. Persistent mucus production leads to coughing, wheezing, and difficulty clearing the airways, making this condition challenging to manage and often requiring medical intervention. 3. Chronic obstructive pulmonary disease. COPD is a progressive lung disease commonly linked to chronic mucus buildup and inflammation in the airways. The excess mucus limits airflow, reduces lung capacity, and can lead to severe breathlessness and fatigue, making daily activities challenging. 4. Asthma. In people with asthma, mucus buildup can worsen symptoms by further obstructing already sensitive and inflamed airways. During an asthma attack, thickened mucus can increase the severity of breathing difficulties, wheezing, and chest tightness. 5. Bronchiectasis. Bronchiectasis is a condition where the bronchial tubes become permanently widened due to chronic inflammation and infection, often linked to mucus buildup. This structural damage results in persistent mucus accumulation, leading to chronic cough, frequent infections, and progressive lung damage. And there you have it, 10 of the best ways to tackle mucus buildup in your lungs and breathe a little easier. These tips aren't just about quick relief, they're about long-term lung health and helping your body work at its best. Whether it's staying hydrated, trying herbal teas, or even doing simple breathing exercises, you now have a toolkit for clearer, healthier breathing. Remember, these methods work best when they become regular habits, so give them a try and find out which ones make the biggest difference for you. Now that we have discussed the many ways to get rid of mucus buildup from the lungs, there are always other signs of health we should look out for. From signs of cancer to signs of poor blood circulation. Interested in learning more? Watch. 10 alarming signs your blood circulation is failing. Or watch, are you ignoring these 10 warning signs of cancer? Watch one, or even better, watch both. Do you also suffer from mucus? Let us know in the comments below.